The health of our communities are impacted by many different factors in society, some of the most impactful being economic factors. The pandemic highlighted the pivotal role our local businesses play in advancing equitable health outcomes for the patients we serve. Today we'll hear from Keith Ellison from the Urban League of Philadelphia's Entrepreneurship Center, who will share his insights into how local businesses are recovering from the pandemic and how they're navigating the path to the new normal. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly, Executive Speechwriter with AHA. In this conversation, AHA's Dr. Leon Caldwell, Senior Director of Health Equity Strategies and Innovation, will highlight the role local businesses play in advancing the health and equity of their communities. He'll be joined in this podcast by Keith Ellison, Program Director of the Urban League of Philadelphia's Entrepreneurship Center, who will share his experience with working with local businesses in Philadelphia and the challenges and opportunities they face during the road to recovery post-pandemic. More is available at www.ifdhe.aha.org.
Thanks, Tom, and welcome, everyone. Today I'm being joined by Keith Ellison, Program Director of the Urban League of Philadelphia's Entrepreneurship Center. Thanks very much for taking time for this important conversation.
Well, thank you for having me, Leon.
So before we begin our conversation, can you please tell me a little bit about yourself and the Urban League of Philadelphia's Entrepreneurship Center?
Sure. As you mentioned, my role is I'm the program director for the Urban League of Philadelphia's Entrepreneurship Center. So the Entrepreneurship program is part of the National Urban League's Entrepreneurship program. And we represent one of 12 centers around the country. And our purpose is to work with businesses to help them create jobs, help them get contracts, help them grow their revenue, get financing, and basically fill the gap between where they are now and where they would like to be. Now, the entrepreneurship program is one of many programs offered by the Urban League. We also have workforce development, where we assist individuals with getting jobs. We have a housing program where we work with families and individuals who are first-time home buyers, as well as those who are on the verge of possibly losing their homes to foreclosure, as well as those who may be evicted. And we have a leadership program as well. And we provide scholarships and various youth leadership programs to high school students. So that just really gives you an overview of what we do, particularly here in Philadelphia.
One of the things that in your overview of the Philadelphia Entrepreneurship Center is that your demographic, the group you're addressing, is the group that we know historically has been economically disadvantaged, right?
Yeah. Mm-hmm.
And we know that this pandemic has even deepened some of that disadvantage.
Right.
So how are communities across the nation, how are they gearing up for kind of a post-pandemic path of recovery?
So as far as the business community, and it's a consistent message really on our part, meaning our part as an economic development entity, one of the messages that we stress to any business owner is to make sure you have the right financial systems in place. So or I would say crisis-proof your business. So that's one of the things. So what the pandemic has done is it really put a spotlight on those businesses that really weren't prepared to take advantage of grant opportunities and certain loans. It is very common for some businesses to really fly under the radar and not file their taxes. We found that with quite a few hair salons and barbershops. as well as other what we call gig type businesses, really one solopreneurs, one person operations that earn money but don't really pay taxes, or if they do, it's minimal. So we emphasize doing the right type of planning, put the right type of accounting system so that you can track your expenses as well as your revenue, so that when a loan opportunity or a grant opportunity is available, someone asks to see your financial statements, which includes your income statements or your balance sheets. You're not trying to track down your accountant. You can actually print that information from your QuickBooks or accounting systems. So that's been the message, and that's what we've really been focusing our attention on, getting businesses ready so that they can really survive and take advantage of other opportunities.
That's all really sound business advice. I really like this idea of make crisis proofing your business.
Right.
Right. I think that's. I mean, we should try to crisis proof our lives as well. But the one thing that's really, I think, profound in that is it does at least start the conversation of like the what ifs, right? If things are not always working well, and anybody who's in business knows it comes in cycles.
Yeah.
One cycle we didn't necessarily predict is COVID-19.
Yeah.
So tell me a little bit about, what's your general sense or your sense of the general impact of COVID-19 on Black businesses in Philadelphia?
Well, I think Black businesses in Philadelphia, just like Black businesses in many urban areas, were impacted in different ways. Some businesses benefited, but some were really hurt. But the businesses that tend to do well were those who didn't rely on face-to-face or in-person contact. So a lot of independent consulting firms, particularly those who were into training and development, or supporting larger companies, and using uh, more of a coaching or counseling business model, they were able to do well. Uh, if you couple the pandemic with the social unrest, one of the things that a lot of my colleagues benefited from was DEI training and consulting opportunities. After the George Floyd situation got so much visibility, a lot of companies started asking themselves, "Hey, what are we doing? How do our people of color feel? Let's really explore this topic of implicit bias." And so that really opened up a lot of opportunities for people in the training and development space to target large companies and other institutions with that opportunity to address those needs. So it really varied in the Black community, but the retail businesses, those who really depended on interpersonal uh, touch, got hit hard.
So it seems as if depending on what sector you are and what types of services you delivered, that you had a varying degree of success or even chance of recovering from COVID-19's economic crush, if you will.
That's correct.
There was also a piece of the COVID-19 crush, which the pandemic ushered in from a health perspective, a new found kind of renewal, if you will, of the importance of health in our communities, particularly as business owners, for
Yeah.
both your own personal health, but also that of your employees. Was there anything that you can see that was done to support COVID-19's impact on the health of workers, the health of business owners in Philadelphia?
Uh, I would say it was not necessarily a concerted effort. I think individuals and businesses took advantage of opportunities kind of organically. So let's really kind of frame the discussion of health. It's the physical health, of course, but there's also the emotional and psychological well-being of business owners, of course, employees, and of course, families. So the whole isolation and the dynamics that came with the shelter in place really exacerbated a lot of stress and anxiety. When it comes to running your own business, that in and of itself has its own stressors and sources of anxiety. And so when you compound that with the uncertainty that the pandemic brought about, as well as even when we start opening up, that really brings a lot more or elevates the stress level and anxiety level of the business owner. Now, what did help alleviate that concern was the PPP and idle loans that many businesses had were able to take advantage of.
That's a good point, Keith, because you bring out this need to consider like integrative health, right? Both the physical health as well as the mental health or emotional health of people in general, but particularly of business owners.
Yeah.
One thing you bring out too is this idea and reality we're confronted with now as things, open up, right?
Mm-hmm.
And one thing that we've heard consistently in the health community is that opening up will require vaccinations, the herd
Yes.
immunity conversation.
Yes.
And we know that opening up is also a code word for economic recovery, right?
Yes. That's true.
So tie these two things together. Like in our communities, vaccinations, the acceptance of vaccines, does have strong implications for the economic recovery.
Mm-hmm.
What are you seeing in small businesses that ties those two together? Are people really like accepting of vaccines and thinking that their connections to being able to get back to business so that HVAC business owner can actually hire those 5 people back? Like, are they making those connections?
I think it varies, and there are a lot of people that I talk to who have already had their shots, and they're proponents of getting shots. Many of whom are business owners that have employees, but they do have some employees who are extremely hesitant. So a lot of the business owners that I speak with, they are open to vaccinations, and they're just hoping that their clients and others are open to it as well.
One thing that you bring up is, for me, is this conversation around our health insurance is usually attached to our jobs or our
Hmm.
work, right?
Yeah.
So as we, go back to recovering, if you will, economically, then do you expect more employers and employees to really take serious this really a privilege, if you will, or a right to kind of health insurance? Like how do you think that's going to land in the world of work as people start to have economic recovery?
That's that's a very good question. And in preparation of today, I done a little bit of research, and I got some I would say broad statistics across the small business community in general. So businesses with fewer than 5 employees will tend not to have or offer health insurance because that is a very expensive line item. Those between that have between 5 and 10 employees will have some level of insurance, and of course, uh, as you have more employees, particularly above 10, they'll have a benefits package. Um, and I don't expect this to change health benefits as a way to be competitive,
Mm.
to attract more people. But my gut tells me that will be a couple years after the pandemic has really subsided.
It's a very interesting point. If health insurance or paying attention to one's health, um, have it being subsidized through your employer as a incentive actually for work. I mean, it'd be pretty interesting to see how that pans out. Also important, I should note, is that Health and Human Services, HHS, is extending access to the special enrollment period until August 15th, which gives consumers additional time to take advantage of new savings through the American Rescue Plan. So if you get a chance, please visit healthcare.gov for more information. What role do you think hospitals play and health systems play in really supporting the growth of not just gig economy businesses or side hustles, as we say in Philadelphia,
right,
but businesses, startups that are owned by African Americans in the communities in which they actually treat patients?
That's a very good question. So hospitals are anchor entities or institutions in any kind of geographic area. They represent a large or a sizable percentage of the employee base. Um, Many hospitals, uh, like many corporations, have a procurement program, and some of them have what we call supplier diversity program, which is or supplier diversity initiatives, which are part of their procurement systems. So if you look at the common needs of a hospital, so you mentioned supplies, um, and of course equipment, but most hospitals also almost every year there's some form of construction, and so that is an opportunity for minority-owned businesses. There are many minority businesses that have the skills, that have the management capability, and the capacity to take on reasonable size projects. Many large organizations will have what's called employee resource groups, and these represent segments of the employee base, such as the African American Association or the Women's Group or the LGBTQ Association. And they have meetings, they have support networks, they have mentoring. Those are ways that they can help resource smaller transactions with businesses that don't meet the what we call the scale requirements for procurement officers for procurement processes. So almost anything that you can think of that employees consume personally or organizations use, that's something that can be sourced in part by what we call a MBE, minority business enterprise.
So really important and useful information. So I hope our kind of listeners are jotting these things down. The work that we're doing at the Institute for Diversity and Health Equity in our trustee match program, right? So one of our opportunities, if you will, is to support our member hospitals and health systems, to place diverse individuals with representation on their boards, to improve governance or representation in governance. How does board representation impact building relationships with small businesses?
Well, here's how it can. I think it's vital. I think you need as many people in the right rooms at the right times asking the right questions. In other words, some of that question, a simple question could be, what is our spend in the Black community or in the minority community? When you don't have diversity, no one thinks about those questions. So when you start asking the right kinds of questions, then you start coming up ways with holding the board and the management team accountable to certain goals. So you can start establishing certain goals, or certain new processes or initiatives to be more inclusive of supplier diversity. And when that's the case, when it's coming from the top, when you have the right people in leadership's ear, asking the right questions and giving the right types of direction and support, you're more likely to follow through and make a difference economically. So that's just from a business perspective, but also from an employee perspective. When someone doesn't see someone that looks like them on the board, or at least in the leadership team, they are less likely to be fully engaged with that company. Or they may not feel as though there's an opportunity to progress. If they progress or they could promote it, it'll be but only so far. And so, I mean, just think about that. You want to contribute. The best type of company is one that has their employees that really brings all of their ideas, their talents, their insights, and their energy to the workforce. And when there's some inconsistencies in what the company looks like versus what the company is saying it's about, then you start to introduce elements of distrust, or at least lack of confidence in one's own long-term prosperity with that firm. And so it starts with leadership, and it's great when it starts from a board of directors. And then again, that's where, so, and let me add this, it's not necessarily just having people on the board, but also demonstrating inclusion when that person's on the board, allowing that person to have a voice, or at least bringing someone with the confidence to have a voice, so that if it's time, that person can make waves or push back to challenge the rest of the board as well as the leadership team of the organization.
Keith Ellison, thank you so much for your time today, for sharing your unique insights and perspectives with us during this path of recovery. And all you're doing in Philly is extremely impressive and helpful to making our communities better again. Thank you for your time and energy and the work that you've done to support Black business owners and business owners of color in the Philadelphia area.
Thank you, Leon. This has been a tremendous experience for me today. I really enjoyed this, and I'm hoping we can meet in person once this pandemic is behind us.
Thank you so much. Thanks for listening. For more information from the Institute for Diversity and Health Equity, please visit our website at ifdhe.aha.org. Thank you so much. Until next time.